Hello, we're looking at a virtual pathology specimen of the descending aorta, and the diagnosis here is aortic dissection. So here is the main pathology, which is a very large hematoma that is dissecting between the layers of the wall of this blood vessel. This is the intimal surface, and let's take a closer look. We can see that there is some atherosclerosis in the form of some fatty plaques or fatty streaks. This is not very severe. And here we have an intimal tear through which the blood is tracking into the wall of the aorta. So the wall is actually markedly thickened and expanded by this hematoma that is present between the layers of the vessel wall. And here we can see on the side view how it is expanding the vessel wall. This is the area of the adventitia. And as we look at the posterior surface, there are some blackish areas here, which are very suggestive of rupture and bleeding beyond the layer of the adventitia. And that is one of the main complications of aortic dissection, that is rupture through the adventitia and massive hemorrhage. Dissection of a blood vessel is defined by blood entering the wall of the vessel and dissecting through the layers of the wall. There are some examples here. This is one that we have just seen. Here is another example again of the descending aorta, and here is the area of dissection, and I will briefly describe this virtual pathology specimen a little later. This is usually due to a structural weakness in the vessel wall. And for example, there is degeneration of the tunica media, which is formed mostly of elastic fibers. There is also often defective extracellular matrix. So what happens is that there is an intimal tear, and it's often very unclear what causes this tear in the first place. And because of the high pressure blood flow, this often occurs in the aorta with systemic blood pressure. The blood will then track through and split the wall apart and dissect through the media. Some of the predisposing factors include connective tissue diseases like Marfan syndrome, hypertension, which is very, very common in aortic dissection, certain iatrogenic factors, for example, previous arterial cannulation, and very rarely in pregnancy, especially in the third trimester, hormones can actually induce some remodeling of the wall of the blood vessels. Aortic dissection often affects middle-aged men who have a history of hypertension, and in patients with Marfan syndrome, this can occur at a younger age. This microscopic picture actually shows the wall of the aorta, and the lumen is actually here. This is the intima. There is a split in the media, and this whole area here is the hematoma within the wall of the aorta. Grossly, this often affects the ascending aorta. That's one of the commonest locations. And you can see here again, this is another example that I will describe briefly later. We can see the dissection here very close to the aortic valve. And the dissection can either progress backwards toward the heart, or it can progress distally, sometimes all the way down through the arch to the abdominal aorta and even all the way down to the iliac vessels. The hematoma often occurs between the outer third of the media or between the media and adventitia. Here is another example. There has been a longitudinal cut made through the intima, and here is the deeper layer of the wall of the aorta. This is the cavity in which the hematoma was tracking. Clinically, these patients, depending on where the dissection is, if it is in the ascending aorta, they will present with sudden, very severe chest pain radiating to the back, often between the scapulae, and the differential diagnosis of this very excruciating chest pain is acute myocardial infarction. The pain can move downwards as the dissection progresses or propagates. There may be complications of cardiac tamponade if this dissection ruptures into the pericardial sac. There can be shock and death as well if there's rupture into the pleural or peritoneal cavity. There can be exsanguination. And If there is dissection to involve the aortic valve, there can be acute aortic incompetence, and also the dissection can affect the branches of the vessels coming off the aorta, which can then give rise to ischemia depending on which branch of vessel is affected. Some of the important complications: rupture through the adventitia giving rise to massive hemorrhage or cardiac tamponade, and also obstruction of vessels branching from the aorta. One potential outcome, which can also occur, which is probably the best possible outcome, is that the hematoma can actually re-enter the aortic lumen. So instead of bursting outwards, it goes back into the lumen through a distal second intimal tear, giving rise to a double-barreled aorta. So in this instance, there is no exsanguination. Let's take a look at a few other examples. Here is another example, and again, this is the descending aorta. And just to turn around, this is the adventitial aspect. We actually have the bifurcation into the iliac vessels distally. This is the cavity in which the dissection set, so it has been taken out, but we can see that it has split apart the layers of the aorta. And as mentioned earlier, usually this split occurs in the media. Here is another case, and you can see here that the ascending aorta is involved. We have this dissection, and this is very dangerously close to the aortic valve. Here, this dissection shows signs of hemorrhage already. And one more final example, again, of the descending aorta. We have the kidneys here, and we can appreciate the dissection here within the wall of the descending aorta, and this one does not show definite evidence of rupture at this point. These specimens are taken from our online pathology resource, Pathweb, and these are taken from our virtual pathology museum inside Pathweb. Registration is free, and you can register using the link in the video description. If you scroll down on each page, you can also see clinical vignettes, gross descriptions, as well as some gross and microscopic images. We also have a video that is very similar to this one that describes the microscopic features of aortic dissection. So in summary, this is an example of aortic dissection. We have here descending aorta, an intimal tear, and dissection of blood into the wall of the aorta here, expanding the wall markedly, giving rise to bleeding into the retroperitoneal structures. A very important, potentially fatal complication of this is rupture with massive hemorrhage and exsanguination. Thank you.